Hello friends, welcome to my YouTube channel. Today we are discussing about multiple choice questions and answers about eye and ENT. Before that, if you are not subscribed my channel, please subscribe. We can see the questions and answers one by one. And the first question, repair of tympanic membrane is termed as. The options are ossiculoplasty, myringeoplasty, myringotomy and audiometry. Repair of tympanic membrane is termed as, and the answer is myringeoplasty. The next question, which of the following is a ototoxic drug? The options are atenolol, amlopryl, furosemide and metformin. Which of the following is a ototoxic drug? And the answer is furosemide. The furosemide is a loop diuretic and is associated with ototoxicity when dose exceeds 240 mg per hour. And the next question, severe hearing loss is observed in the decibel range of, and the options are 41 to 55 dB, 56 to 70 dB, 71 to 91 dB and more than 91 dB. Severe hearing loss is observed in the decibel range of, the answer is 71 to 91 dB. And the next question, most common site of epistaxis is, the options are little area, Woodruff's area, maxillary sinus and nasopharynx. Most common site of epistaxis is, the answer is little area. The next question, type of cells involved in the laryngeal malignancy are, the options are small cells, large cells, thin cells and squamous cells. The type of cells involved in the laryngeal malignancy are, and the answer is squamous cells. And the next question, for a tracheostomy patient, suctioning is needed at an interval of, the options are 15 minutes, 30 minutes, 1 hour and 2 hours. For a tracheostomy patient, suctioning is needed at an interval of, and the answer is 30 minutes. And the next question, the condition in which eye is slightly metropic for red rays and myopic for green rays is called, and the options are presbyopia, astigmatism, ametropic eye and emmetropic eye. The condition in which eye is slightly metropic for red rays and myopic for green rays is called, and the answer is emmetropic eye. And the emmetropic eye is corrected with adjusted convex lens. And the next question, myopia is corrected with, the options are concave lens, convex lens, cylindrical lens and adjusted convex lens. The myopia corrected with, and the answer is concave lens. In the next question, what is the specific purpose of administering prostaglandin for glaucoma? The options are increase IOP, increase aqueous outflow, decrease aqueous outflow and open spaces in trabecular meshwork. What is the specific purpose of administering prostaglandin for glaucoma? The answer is increase aqueous outflow. The next question, normal intraocular pressure is, the options are 5 to 10 mm of Hg, 10 to 21 mm of Hg, 21 to 30 mm of Hg, 25 to 40 mm of Hg. Normal intraocular pressure. And the answer is 10 to 21 mm of Hg. And the next question, the best visual acuity with corrective lens in the better eye of 2 by 200 or less is considered as, the options are normal vision, decreased vision, blurred vision and legally blind. The best visual acuity with corrective lens in the better eye of 2 by 200 or less is considered as, and the answer is legally blind. And the next question, what is the earliest sign of cataract? The options are decreased color perception, diplopia, reduced visual acuity, absence of red reflex. What is the earliest sign of cataract? And the answer is decreased color perception. And the next question, postoperative therapeutic position for cataract surgery. The options are flat position, sideline position, Fowler's position and prone position. Postoperative therapeutic position for cataract surgery. And the answer is Fowler's position. And the next question, earliest sign of glaucoma. The options are loss of peripheral vision, halos around light, headache and diminished accommodation. Earliest sign of glaucoma. And the answer is loss of peripheral vision. The glaucoma is a group of eye condition that damage the optic nerve and leads to permanent blindness. The next question, in acute glaucoma, expected intraocular pressure is, the options are 20 to 30 mm of Hg, 30 to 50 mm of Hg, 50 to 70 mm of Hg, 70 to 90 mm of Hg. In acute glaucoma, expected IOP is, answer is 50 to 70 mm of Hg. And in the case of chronic glaucoma, the IOP is 30 to 50 mm of Hg. The next question, ocular melanoma usually located in, the options are retina, uveal tract, macula and iris. The ocular melanoma usually located in, and the answer is uveal tract. The ocular melanoma is a most common malignant eye tumor in adult. The next question, presence of blood in the anterior chamber of eye is termed as, the options are hyperemia, hyphema, hemoconjunctiva and ectropion. The presence of blood in the anterior chamber of eye is termed as, and the answer is hyphema. And the next question, which one of the following is a mitotic medication? The options are atropine, cyclopentolate, pilocarpine and tropicamide. Which one of the following is a mitotic medication? And the answer is pilocarpine. The mitotic or cholinergic medication reduces the eye pressure by increasing the drainage of intraocular fluid through the trabecular meshwork. And the next question, antidote of pilocarpine. The options are anticarpine, cytocarpine, atropine and neostigmine. Antidote of pilocarpine. And the answer is atropine. And the next question, what is contraindicated for a patient with glaucoma? The options are mitotic medication, mydriatrics, corticosteroids and NSAID. What is contraindicated for a patient with glaucoma? And the answer is mydriatrics. The mydriatrics are used to dilate the pupil of eye. Some eyes with open angle glaucoma may develop increased intraocular pressure under mydriatrics. So, it is contraindicated for a patient with glaucoma. The next question, in air irrigation, solution can be prepared at the temperature of, the options are 110 degree Fahrenheit, 101 degree Fahrenheit, 105 degree Fahrenheit and 98 degree Fahrenheit. In air irrigation, solution can be prepared at the temperature of, and the answer is 98 degree Fahrenheit. And the next question, which is the shortest acting mydriatric? The options are atropine, tropicamide, cyclopentolate, homatropine. Which is the shortest acting mydriatric? Answer is cyclopentolate. The next question, a gradual painless blurring of central vision is chief clinical manifestation of, the options are cataract, glaucoma, Presbycusis, retinal detachment. A gradual painless blurring of central vision is chief clinical manifestation of. The answer is cataract. The next question, bony overgrowth which lead to fixation of ear ossicles is termed as. The options are otosclerosis, mastoiditis, labyrinthitis, Meniere's disease. Bony overgrowth which leads to fixation of ear ossicles is termed as. And answer is otosclerosis. And the next question, pinkish discoloration of tympanic membrane in otosclerosis is termed as. The options are Battle sign, Schwartz sign, auditory sign, none of the above. Pinkish discoloration of tympanic membrane in otosclerosis is termed as. Answer is Schwartz sign. And the next question, a reddened, dull, thick, immobile tympanic membrane is sign of. The options are external otitis, mastoiditis, otosclerosis and Meniere's disease. A reddened, dull, thick, immobile tympanic membrane is sign of. And the answer is mastoiditis. And the next question, swimmer's ear means. The options are otitis media, tympanitis, external otitis and ear plug. Swimmer's ear means. The answer is external otitis. The next question, benign overgrowth of squamous cell epithelium of inner ear is termed as. The options are cholesteatoma, labyrinthitis, schwannoma and vestibuloma. Benign overgrowth of squamous cell epithelium of inner ear is termed as. And the answer is cholesteatoma. And the next question, benign tumor of vestibular or acoustic nerve. And the options are acoustic schwannoma, acoustic neuroma, vestibuloma and none of the above. Benign tumor of vestibular or acoustic nerve. And the answer is acoustic neuroma. And the next question, sensory neural hearing loss associated with aging is. The options are otosclerosis, presbyopia, Meniere's disease and presbycusis. Sensory neural hearing loss associated with aging. The answer is presbycusis. Next and last question, the most common cause of impacted auditory canal. The options are cerumen, wax, foreign body and both A and B. Most common cause of impacted auditory canal. Answer is both A and B, that is both cerumen and wax. Thank you friends. Thank you for watching. Please subscribe my channel for more videos. Please like and share this video.